So you have the semitendinosus, semimembranosus, and then the biceps femoris. What's this structure here? Okay, what is this big bony structure here? The whole thing.
The pelvis.
The pelvis.
The pelvis.
The pelvis. So right in the center, this must be
sacrum.
This is sacrum, that's right. And what's down at the bottom of the sacrum?
The coccyx.
The coccyx. That's right. What's the upper half of the pelvis called, this bone? Is it the ilium or the ischium?
Ilium?
It's the ilium, yes, with the posterior superior iliac spine and the anterior superior iliac spine, and also the anterior inferior iliac spine. But anyway, ilium and then ischium. Ischial tuberosities, sit bones, the bones that, you know, protrude and stick into the chair when you sit down. Ischial tuberosity. So above the ischial tuberosity, or on the ischial tuberosity, there are tendinous attachments for the hamstrings. So they act on the pelvis and the leg. They attach on the humerus, they attach on the tibia and the fibula. And they are named the biceps femoris, femur, femoris, biceps for two-headed muscle. The long head attaches to the pelvis. The short head attaches to the femur. So you can tell that this muscle serves mainly to flex this joint right here, the knee joint. Can you guys envision that? This end is the origin. It's not going to move that much, but this bone has a joint next to it. It's going to move a lot. So
origins, how you tell the difference between origins and attachments is the origins typically moving?
The origin is typically not moving. The origin is typically the more stable of the two.
Okay.
The more stable of the two, yes. And I'll continue to point out origins and insertions to you. So, you know, feel free to ask at any time. So here's the origin for the biceps femoris up here and here on the femur. And then here's the insertion for the biceps femoris. And here's the origin for the semitendinosus, semimembranosus, which are on the medial side. So if you can see the sacrum, you know the midline is here. And you know that these muscles are more medial and these muscles are more lateral. And that should tell you that these are the biceps femoris. The biceps femoris are the lateral ones. The semis are the medial ones. Semitendinosus, semimembranosus. I don't know why they named them that way. Someone thought that this had strongly resembled a tendinous fibers. Maybe there's more tendinous fibers in one. Someone thought that the membranosus resembled a membrane. Muscles are often named after their shape, how they move, their size, like magnus, minimus, longus, brevis. So tendinosus and membranosus. Okay, what they give you on this page is Gray's Anatomy, which is good, but not great. Okay, so let's move on. I don't want to get into too many specifics about those muscles. So those are the hamstring muscles. And then if we look at the let's type in hip flexor muscles, and you see if you type in hip flexor, Google says it's the iliacus, the psoas, the pectineus, rectus femoris, and sartorius. So we will look at the sartorius, and we may or may not look at the pectineus. We're definitely going to look at the other four: the rectus femoris, the psoas, the iliacus, and the iliopsoas. Again, Physiopedia. So here you have the spine. Here's the sacrum. Here's our friend the sacrum. So this cut here must be right down the midline. Here's the floating rib, 12th rib. And here's the ilium, crest of the ilium, right? Iliacus is the name of the muscle on the inside of the ilium, They don't show the attachment, but the attachment, the insertion, is on the femur down here. right? So here's the leg bone. The femur is under all the muscles. And the fibers of the iliacus, they originate, their origin is inside the ilium, inside the hip, inside the pelvis. That's not going anywhere. And they insert down on the leg. So the leg, the femur, actually moves. It flexes when this muscle contracts. Also for the psoas also originates along the spine and inserts on the femur. The psoas can move the spine quite a lot, but I believe that the insertion is on the femur. And the fibers down there are often referred to as the iliopsoas. Iliopsoas. And this is a term that you very well may see. So if you look at, iliopsoas and the iliopsoas muscle and its frequently overlooked syndrome. I'll give you a couple hints clinically, which you're not going to be tested on, but if someone has hip flexor pain or lower back pain that is on one side of the spine, going the whole length of the lumbar spine from this side is not loading, from, for example, L1 to L5, from L1 to L5, and hip flexor pain on one side, it's likely the psoas muscle. It's very likely the psoas muscle. Also, other symptoms can accompany psoas or iliopsoas symptoms. And those symptoms can have to do often with their proximity to the digestive organs or their proximity to the diaphragm. So people sometimes with tight psoas muscle can sometimes feel, because the diaphragm attaches up here, they sometimes can feel difficulty breathing, taking a deep breath, and they sometimes can feel nausea. I think because the diaphragm is probably spasming a little bit due to the iliopsoas being so tight. But you can see the psoas muscle originating on the spine, coming down and attaching onto the femur. Notice it's a little bit on the inside of the femur. If a muscle is on the inside of the bone, which way is it going to rotate the bone? Internally or externally?
Externally?
Internally. Yeah, let's do that again. If a muscle's on the inside of the bone, which way is it going to rotate the bone? Inside or outside?
Inside.
Inside. If a muscle attaches to the outside of the bone, like the tensor fascia lata, which way is it going to rotate the bone? Inside or outside?
Outside.
Outside. That's right. Exactly right. Okay, and here's the fibers of the iliacus. And they come down and they join, and right about here would be considered the iliopsoas muscle. Okay, I hope that you guys, I hope that's clear enough for you guys. The iliopsoas and then the semimembranosus tendinosus and the hamstrings. If we're looking at the iliopsoas, iliacus, psoas, iliopsoas, if we're looking at the iliopsoas, what movement are we talking about? Are we talking about flexion, hip flexion, or hip extension?
Flexion.
Very good. Is it the same muscles moving when the foot is on the floor, like a closed chain, like a squat or deadlift, as it is when the foot is floating up off the floor, like running, which is open chain?
Open chain.
Is it the same muscles?
It's the same.
It's the same muscles. Yes,
Same.
it is. Yes, it is. And there's other muscles involved which do hip flexion. Can you guys name me a couple of those muscles, even just broadly?
Inflation. Look at the tensor fascia.
Yeah, tensor fascia lata, yes. But a broad statement would be something like the quadriceps. Quadriceps muscles, right? And the quadriceps are made up of rectus femoris. Mute yourselves and repeat after me. Rectus femoris.
Rectus
Practice
femoris.
mirror.
Yeah, but mute yourselves because we're gonna do it 3 times. 3 times 4 is 12. It's rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, which is underneath the rectus femoris. So rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. Last time, rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis. There's also other muscles which are considered part of the hip flexor group. Tensor fascia lata can function in hip flexion, although for external and internal rotation, it's more powerful. So it assists, it's a synergist in hip flexion. Sartorius is considered a hip flexor muscle, as is the gracilis. I don't know if these are synergists, the gracilis and the sartorius, or if they're considered prime movers. I don't think they're prime movers, but anyway, the sartorius attaches on the iliac crest and then attaches to the inside of the tibia down below the knee. It attaches inside here on the medial side of the tibia, which means that when this muscle contracts, which way is the kneecap going to point? Is it going to point outside or inside?
Outside.
Very good. And outside is called external or internal rotation?
Would it be
External.
external?
External rotation. Yes. Yes. Excellent. You guys are sharp, and that's no lie. Okay, so we got a few more of those